Thank you, Sarah, and welcome everyone. So it's my pleasure to introduce our speaker today, Fatima Mussa. Fatima is a project coordinator at Access Alliance Multicultural Health and Community Services. As a daughter of determined refugees and a Master of Public Health alum from the University of Toronto, Fatima uses her platform to engage communities, service providers, and policymakers in actions of systems change for refugee health. So thank you for joining us, Fatima. Please go ahead.
Thank you, Lorraine and Sarah, for this opportunity. So I'm just going to show my screen now so that you can see my presentation. Okay, so thank you everyone for joining us today for this webinar. And as Lorraine mentioned, my name is Fatima Mussa, and today I'm going to be sharing with you some of the findings from a study, an environmental scan study that we did here at Access Alliance. And I'll be highlighting some of the key findings in particular that relate to collaboration and coordination across sectors. So first off, I'm going to just provide you with some of the objectives for today's presentation. And our project in particular focused on the Syrian refugee response that occurred from 2015 to 2016 and documenting some of the experiences from service providers across different sectors. But these findings and recommendations that I share with you today are applicable to resettlement broadly. So just to provide a bit of context, and I'm sure many of you already know this, but in 2015, in the fall, the Liberal Party made a commitment to resettle 25,000 Syrian refugees, and this was a high volume of arrivals within a short period of time. So the goal initially was to resettle 25,000 refugees from Syrian background by the end of December 2015. And this was actually, this goal was actually met by the end of February 2016 with about over 14,000 government-assisted refugees arriving, as well as more than 8,500 privately sponsored refugees and over 2,100 blended visa office referred pathway refugee arrivals. And by the end of January of this year, in 2017, over 40,000 Syrian refugee newcomers have arrived to across 350 communities in Canada. So first I wanted to show you what the provincial level response was in particular. And from the health care provider perspective, there was a health action plan that was developed by the province of Ontario and the Ministry of Health and Long-Term Care. But what I wanted to highlight here is that although this is a health system focused plan, some of the other key systems that are important for refugee resettlement and the social determinants of health are highlighted here, and especially when it comes to collaborating and coordinating with other sectors. In particular, settlement, immediate settlement needs, as well as housing and transportation are all key elements that were described in the Ontario Health Action Plan. And the phases 4 and 5 of resettlement, as you can see on the left side of the screen, which is welcoming in Canada and settlement and community integration, were key phases that providers and agencies were involved with throughout this response. And the province as well also activated a Ministry Emergency Operations Center to share information as well as further collaboration across levels of government and partners. So in my role, I work at Access Alliance, and one of the things that we were doing here is conducting an environmental scan, because from Access Alliance's coordinated efforts with agencies during this response across the healthcare sector, settlement sector, as well as community sector and nonprofit agencies, it was clear that documentation of this experience was necessary. So this drive to document and recommend best practices for future responses resulted in Access Alliance receiving funding from United Way, Toronto and York Region. So this is a 12-month project that we've been working on, which focuses on assessing and sharing successes, challenges, and best practices in order to inform and enhance practices and policies of service providers that collaborate together to serve refugees. And so through this project, we've currently created a report summary of our key findings, which I'll share the link with you at the end of this presentation, but we're hoping to produce a detailed final report as well at the end of August 2017. So the regions of focus for this project included the City of Toronto, the region of Peel, and the region of Waterloo. And the City of Toronto and region of Waterloo were included in particular because these are the 2 of the 5 communities in Ontario that receive a majority of immigrants and refugees. And the region of Peel was included because there was a significant secondary migration of Syrian refugees to this region. So just briefly to share some of the project methods that we used qualitative research methods to develop guiding questions to assess these challenges, successes, and best practices and recommendations. And for this project, we conducted 22 key informant interviews. We also worked closely and trained and mentored Syrian refugee peer researchers throughout the phases of the research project. So our 2 peer researchers were involved in designing the methodology of this project, as well as data collection and data analysis. And our project team was diverse and included peer researchers, social work, and Masters of Public Health students, a nurse manager here at Access Alliance, as well as researchers and student volunteers. And we used NVivo, which is a qualitative research data software, and a collaborative data analysis approach to assess emerging themes from the findings. So from the participants, we had 10 participants representative from the healthcare sector, 6 participants from the settlement sector, 3 participants from the government and policy sector, 2 coming from primarily from the nonprofit community sector, and 1 from a faith-based or agency sector. And by the regions, we had 11 participants from the City of Toronto or Greater Toronto area, specifically City of Toronto, sorry. 6 were from the region of Peel and 5 were from the Kitchener-Waterloo area. And I also wanted to show you a breakdown of the participants when it came to frontline versus senior level. So we wanted to capture both perspectives. So we had 8 participants that were considered frontline participants or providers, and 14, were from the senior level of their agency. And so I just wanted to note that some of the frontline staff who are considered frontline as participants are also senior level within their agencies, but their primary role in their fields of work is to provide frontline care, so we have documented them as frontline workers. So in terms of our emerging findings, and this is a picture from one of our collaborative data analysis approach, I want to share some of the key findings from our research. So firstly, the Syrian refugee response from 2015 to 2016 was an extraordinary response. And it was an initiative that was undertaken from various sectors and areas of support that agencies collaborated with directly or indirectly. And from these areas of support, frontline providers and senior level leaders, as well as community members and media, were all significant participants. So as you can see on this slide, we've documented 15 different sectors or areas of support that were mentioned by participants as being directly or indirectly involved in these collaborations that they took on. And we ranked them in order of reference. So however many times it was referenced in our research, healthcare and settlement were referenced the most, and community and nonprofit as well. And things like police and safety, research, faith-based agencies working with employment sector as well were, also referenced, but not as often. So that's why they're closer to the bottom. And collaborations that were mobilized during this response became effective formats of mobilizing resources and communicating information across these sectors. So for example, in Peel region, a large community meeting was convened with community partners and agencies from about 200 people showed up asking what is it that we need to do. So people were ready to go and to collaborate with each other. And within the healthcare sector, there were many subsectors that were involved, which included mental health specialists, public health, primary health, of course, midwifery as well, and dental. Within the housing sector, landlords, shelters, and temporary accommodations, including hotel representatives, were mentioned. And within the community and nonprofit sector, volunteer support was heavily mentioned. So this slide here shows a collaborative response model that we developed with our partners at Scarborough Community Health, Scarborough Center for Healthy Communities, as well as CHC, or Community Health Center in Ottawa, called Somerset West, and Hamilton Urban Core Community Health Center. So these community health centers also worked to lead the response in their respective cities. And the responses in terms of collaborating with different sectors and partners, especially when it came to temporary accommodation sites, which were primarily hotels, was very similar. So we've created this collaborative response model to kind of show what that kind of interaction was like. So initial planning phases, were taken on by various partners, and at the second stripe, you can see that settlement agencies led the response and the operations at the temporary accommodation sites, or primarily hotels. And so, you had hospitals and specialists, faith-based communities, volunteers, school boards, primary care hubs, all coming and centralizing their services at the temporary accommodation sites, and these became community building hubs with services from a variety of agencies being centralized in these locations. And government-assisted refugees that were based at these temporary accommodation sites were receiving these services, but privately sponsored refugees were also gauging the services from the primary care hubs and other community agencies that were serving Syrian refugees. So another key finding was, the vast level of innovations that were created during this response, especially in partnership with different sectors. So, many innovative partnerships, programs, and interventions were mobilized to respond to the needs of the Syrian refugee families. Within agencies, new staffing positions were created and shared between agencies. For example, 2 positions were created for Syrian mental health workers and settlement, and that they were shared between settlement agencies. And this was an effective use of resources because the agencies were uncertain about the needs of these refugees, particularly for mental health services. So the solution was to share these staff across the agencies. To assist with housing the families, in Toronto, partnerships were created with private landlords who offered discounts to families and other supports. In the region of Waterloo, a housing registry was created by an agency where landlords and other housing partners were able to register their vacancies. And this information was then shared with that centralized agency and other privately sponsored refugees. And this was a unique time when private landlords were working closely and collaboratively with settlement agencies to meet the housing needs of refugee families. The settlement sectors and school boards also collaborated to map out refugee resettlement using postal codes in order to notify school boards of the location of resettlement so that schools were aware ahead of time of new arrivals. And this helped with getting children into schools as soon as possible as well. And to meet the overwhelming cost of this response, a community fund was set up in the Kitchener-Waterloo area where over $800,000 was collectively raised in donations. And these funds were made available to agencies and private sponsorship groups and also helped to supplement existing programming in order to deliver it in other languages. So for example, agencies that were not able to access funding for whatever reason, in particular community agencies that needed funding for interpretation, were able to access dollars from this community fund to fill those existing gaps. And many of these new developments and partnerships that were mentioned as innovations can be used moving forward to support all refugees in the resettlement process. So during this response, there were many innovations and successes. So we wanted to document what were some of those reasons for success. And one of the key reasons for success that was mentioned was simply goodwill. So goodwill facilitated this response, as well as collaboration across sectors and agencies to work together. The passion and support that was exhibited by all that were involved in the response was mentioned as a key ingredient to this success and innovations that were developed. Goodwill in particular that was demonstrated by volunteers also allowed for immediate resettlement needs to be addressed. And, agencies across sectors, had many different volunteers coming in to share their support. And they were, taking care of the little things, even like supporting people with transportation, navigating the healthcare and transit systems, and also when it came to things like how to go to the dollar store and pick up hair ties for one's family and daughters. The volunteers stepped up to the plate and actually supported refugee families to be able to access those things. And that was something that one frontline healthcare provider in particular mentioned as part of that goodwill that volunteers displayed. Another reason for success that was mentioned across the board was having senior level leadership engaged in the collaboration process. So support from leadership of agencies and various levels of government as well, often at these same collaborating tables that exist that were created for this response, facilitated communication, immediate response delivery, resource allocation, and fast decision making, which hasn't necessarily been seen to this extent in previous resettlement responses. And one of our participants who was senior level official at a settlement agency mentioned that having a school board leader as part of these collaborating tables really facilitated the registration of children into school right away. So this participant mentioned that at these collaborating tables, they described the scenario that they had at the hotels, and they came up to this official after the meeting and said, why aren't those kids in schools? And they said, I don't know. Can they be in schools? And the school board leader said, yes, absolutely. And they pulled it together within 2 days. And both school boards in that location in Toronto came on board and were, having those high-level people from that department of directors made that whole thing happen, in her words, in a flash. So that's an example of the value of those collaborative relationships that existed during the response. However, the large volume of refugee arrivals in such a short time, was a major challenge, and that was highlighted by many of the participants. And this challenge led then to many other challenges that were faced by agencies and sectors that were involved in the Syrian refugee response. So, and I recognize too that we're talking today about collaborating for refugee resettlement broadly, and these key challenges are, not only faced when it came to this response, but have been faced in the past from what I've gauged from my discussions with other providers, including settlement workers. But at the same time, the volume of arrivals really exacerbated some of these challenges. So one key challenge was communication and information gaps. So although there was regular ongoing planning that was done, for example, with federal bodies such as Immigration, Refugee and Citizenship Canada, or IRCC, the actual number of refugee arrivals that was to be expected were provided just more than a couple of days, with more than just a couple of days notice. That resulted in one participant describing arrivals just coming in and hitting them in a blast. And this lack of timeliness of information regarding arrivals and when they would be departing and their health status and medical and accessibility needs really made it difficult to collaborate across agencies, right? So especially when it came to temporary accommodations, and working together to communicate this information across services that were at these centralized locations, it became very difficult to collaborate with each other because of this lack of timeliness of information. Also, having little knowledge about the pattern of arrival affected the ability of service providers to be able to ensure that planning was done well ahead of time. So planning for things like the space, for temporary accommodation sites, ensuring that there would be adequate interpretation or translation services provided upon arrival, and of course meeting these accessibility needs. So planning and collaboration were both key areas that were affected by these communication gaps. Furthermore, funding and resources, of course, was mentioned as a key challenge. And one of the things that was mentioned was that additional funding that was allocated to larger agencies by provincial and federal governments, was there, but smaller agencies were not prioritized for this additional funding that was provided. And this in turn affected collaboration as well as delivery of services. And healthcare providers also mentioned that there was this lack of funding that was available for interpretation specifically. One of our participants who's a frontline healthcare provider mentioned that interpretation is not something that's covered under OHIP, and it's largely not something that's covered under the interim federal health or IFH program either. And although there are exceptions under IFH, they, typically for primary care or specialist care appointments, interpretation is not covered, and a lot of agencies have a policy of bringing an interpreter yourself, which is problematic for refugees. And this participant mentioned that they may not have the ability to find an interpreter or partial interpreter or an interpreter at all to help out with these assessments. So they said, I think it's a function of the larger health system as well as individual policies by healthcare agencies. Another key challenge that was mentioned that we found that was unique in relation to the resettlement that was emerging in our findings was fairness and equity. So when it came to privately sponsored refugees as compared to government-assisted refugees, among the Syrian refugee newcomers that were coming in during this time, there was differential treatment among this cohort of refugees. So one provider from a faith-based agency mentioned that 2 different classes of refugees were created. Some refugees who arrived to Canada with a loan and some refugees who arrived to Canada without. Not only that, other refugees arrived in Canada and received all of these outfits, so clothing, for example, and others arrived with nothing or got nothing. And others, were received by the Prime Minister, and some did not even have a real person to pick them up. So that differential treatment within the cohort was a challenge. And there was also differential distribution of resources to the same group of refugees, Syrian refugees, but coming from different arrival pathways. So for example, government-assisted refugees in the same class, like a same link English class, for example, getting bus tickets, but the privately sponsored refugees in that same classroom were not getting those bus tickets. So that differential distribution was, an issue. So one of our participants, who's a senior level official from a settlement agency, mentioned that, now try to explain to 2 refugees from the same war and program why X is getting a bus ticket and the other doesn't. So that, again, that fairness and equity of distribution of resources was an issue. And when comparing the provision of support to Syrian refugees compared to other non-Syrian refugees, one thing that stood out in our findings was the ethics of donation usage that was mentioned. So, with all this goodwill, there were so many donations being shared, but the donations that were being provided with the intention of, being distributed to Syrian refugees, some faith-based agencies were not able to use those resources for other refugees. And that was also mentioned as a challenge, when it came to even settlement agencies trying to provide programming for, for refugees across the board. People who were trying to provide services might say, oh, we only will provide service or funding for this program that will be geared towards Syrian refugees. So again, that differential, service provision was mentioned as a challenge. And coordination was also described as a major challenge by many of our participants. The lack of a central coordinating group made it difficult to put all of these different pieces of the response together, especially when determining roles and responsibilities of each agency. Participants described how many agencies were planning independently and that within agencies there was also a lack of clarity around the scope of individual roles. This lack of clarity made some staff hesitant on taking on certain activities outside of fear of losing their jobs. This made it especially challenging when connecting refugees with services that they needed, such as primary care. So for example, when arranging medical appointments along with other supports such as childcare, transportation, and interpretation, there was a lack of clarity about which agency was responsible for arranging which piece. Participants also described that there was an overwhelming response from volunteer groups, but because there was a lack of designated staffing to coordinate volunteers, many were not well received. Furthermore, despite a large number of volunteers showing interest, coordination of these groups was challenging because not all were available when they were needed due to their own responsibilities for their jobs and families, etc. And one of our participants talked about how when coordinating volunteers, a lot of volunteers, a lot of companies that are donating their support, it's great. However, that initial stage was overwhelming just because of the amount of support and trying to manage this while there are arrivals of newcomers still coming. And finally, meeting those community-specific needs. So when determining the location of resettlement, for example, participants described how families became connected and developed friendships in the hotels, and so they preferred to move to apartments and homes nearby each other. However, it was difficult to arrange affordable housing for such large families nearby each other. Also, many preferred to move to Mississauga, where there was an existing Syrian and Arab community, and there are culturally specific resources available, such as Arab grocery stores and so forth. However, balancing this need with the high cost of living in Mississauga and poor public transportation system was difficult. And there was also challenges navigating the healthcare system for this group due to limited interpretation services and having to take other factors into account, such as transportation, childcare, car seats, especially due to large family sizes, with some families having 11 to 12 people. And in regards to health services, there was also a lack of recognition that there would be pregnant women in this group and that pregnancy care and birth control would be an urgent need for this community. So now I'd like to move on just to share some of the promising practices and recommendations that resulted from our study. So firstly, communication. Within communication, the speed or timeliness of facilitating communication is important, particularly when it comes to data on arrivals of refugees. And one participant here from a senior level official of a healthcare agency mentioned that communication was one of their key recommendations, knowing timely information on when newcomers are arriving, how many, and what's their healthcare status. They can respond quicker, and there's an actual opportunity for planning. And once they have ongoing information coming in, they can think about pulling in planning teams and thinking about what the model of care will look like, and then implementing it quickly. Also, recognizing who is involved in facilitating this communication is important. In the region of Waterloo, for example, there was already a centralized, network of agencies that were coordinated by a single body that then took in all the channels of information and brought it back out to all the partners in a way that was coordinated. So one organization kind of creating those information sessions, those communiques that will be spread back to the partners so that they know what is exactly, what exactly do I need to know, rather than one agency getting all this information at once and having to try and make sense of it. And of course, ongoing communication is needed. Funding was another recommendation. When it came to funding, there were many recommendations within that. And one of them was that I wanted to highlight here is the need to have the knowledge of funded structures. So frontline service providers in particular can focus on building awareness around currently funded structures or agencies in the community that can lead or coordinate responses. So for example, local immigration partnerships are federally funded structures that already work to bring sectors and agencies together at tables. Ensuring effective engagement at these tables is key to collaborating and having knowledge about the available resources to support refugee resettlement. In order to provide help with dignity, it's also important to plan not only for the big things, but also for the little things. So for example, one of our participants described how they've seen families carrying their life's belongings in a black garbage bag once they were moving from the temporary accommodation sites to their permanent housing. And during the planning process, time should have been taken aside to arrange for suitcases to be donated to these families. Another participant described that there was exhaustion and loneliness working in the hotels and that it would have made a big difference to have short debrief meetings to help the staff unload. They also described how one NGO provided a basket of granola bars and boxes of bottled water, which was a simple gesture but really boosted the morale of staff. So yesterday we conducted a symposium on some of our findings, and we were encouraged by the response to this in particular. So again, frontline, staff in voicing that debrief sessions and self-care during high stress responses can really make a difference in the care provided to newcomers by frontline staff. So managers are also aware of this. From our symposium, there were senior level officials who were, really responding to that particular point as well. And when it comes to collaboration, it's important to engage the local community, especially previous newcomers, in systematic processes throughout planning and responding processes. There was a lack of planning with local communities in the beginning. However, having these groups involved helps to provide an understanding of what the needs are of the group, and also allows for culturally appropriate planning to be done. And we should also collaborate with the media for coverage in order to provide accurate information about refugees and the responses that occur in resettlement. And this in turn impacts the way in which community perceives the group coming in. Partnering with the media also helps in leveraging support for donations and involvement of other groups to help in the process. So one senior level official from a government and policy sector mentioned how they had worked closely with local TV providers, newspapers, and had regular coverage of things that were going on to create good profiles about the families that were there, and also leveraging support through the media. And building on the momentum of this response that was facilitated by Goodwill is another key point when it comes to collaboration, to continue these collaborating tables that were created. So many different working groups and collaboration tables were created across these regions, and I'm sure among many other regions in Ontario. So trying to think about how to keep these working groups and collaborating tables that were created in this response moving forward to address refugee resettlement issues, not only for Syrian newcomers, but for refugees across the board. As well, coordinating and clarifying roles is important. So in terms of coordination, many participants described the need for a coordinating body which creates a standard model of care and support and provides direction to agencies, assigning them with roles and responsibilities, especially for such a large-scale response such as the Syrian refugee response that past year. This helps in putting all the pieces of the response together and outlines which sector, which agency is responsible for each piece. Within agencies, there also needs to be a concrete understanding of staff roles and the scope of each role, and having managers who can clarify this within each agency can make a huge difference. Roles should also be distributed between agencies rather than being fully placed on one agency's plate, because the reality is that one agency cannot do it all. Additionally, staff working with agencies should be allowed to self-select their participation and tasks, because as one participant mentioned, there are different attitudes to this type of work, especially within such a short time and a large arrival of refugees at a single time. There are different attitudes to that type of work, and some people may want to leave sharp at 5, while others are willing to stay late. And in this particular time where agencies are understaffed, one of the biggest motivators is having individuals who are like-minded, motivated, and are on board. And one of the final recommendations is to build evidence. So expectations about newcomers, according to one participant, were based on previous immigration arrivals of Syrian Canadians and hindered effectiveness of this particular response. So one participant mentioned how literacy levels, number of children, exposure to the outside world are things that should be taken into account when it comes to planning. So they mentioned that with this response, we have seen clients who have never seen the capital of their country, but the expectations, again, were based on the previous waves of newcomers of Syria who were skilled workers, who were more savvy. So everything has been set up with that mindset. But because a lot of the organizations, that's not their core demographic, they weren't able to adjust in time. So through reflection, it's important that we build evidence to further understand communities and recognize information about refugees arriving ahead of time, so that we can support them effectively once they arrive. And the last recommendation, of course, and I think many of you might already agree with this, there needs to be a stronger government role. So we've heard examples of municipal regions in supporting planning in these 3 regions that we focused on during our study. But participants emphasize that federal and provincial government bodies need to be more involved in the planning and coordination with frontline services and agencies that are supporting refugee resettlement. And, government bodies need to take a more proactive role in facilitating collaboration as well. So with that, I'd like to, conclude this presentation. And my information, contact information is on the screen. If you'd like to contact me with any questions or feedback that you may have, please feel free to do so. And the link to our report summary that was released yesterday is here on this slide as well. So you can then download the PDF of our report. And again, our detailed report will be released later in August. So now I would like to take any questions that you may have specific to this presentation.
Thank you very much, Fatima. That was great.
Thank you.
So just once again, people are welcome to either type their questions in the chat box or click on the hand icon if they'd like to be unmuted to speak. And just to start, actually, we did have a comment come in from Marika regarding interpretation. Marika, I will just unmute you if you would like to share that with us. Marika, are you there?
Yes. Can you
Please
hear
go
me?
ahead. Yes.
Yeah, my comment was just one of the things you had said was that interpretation is not covered by OHIP.
Mm-hmm.
And we thought that that was maybe a bit misleading. So I'm calling from a resettlement agency in Waterloo, or a RAP center.
Okay.
Refugees. And
sorry, I didn't hear the last part that you said.
We work with government-assisted refugees.
Okay.
And we have learned that there are hospitals in our area that have within their budget funding interpretation.
Mm-hmm.
So that, if someone is going into labor or they need surgery or an emergency procedure like that, the hospital provide the interpretation. That is available to refugees who don't have enough English language. So I think that healthcare workers and the general public are not really aware of that.
Mm-hmm.
Educate the public that is something that is in hospital budgets and ask for that, and that not always on the resettlement agency provide that, because once the client within the hospital system, they are a client of the hospital should be able to provide interpretation that is necessary for the
Okay.
Thank you. Yeah, thank you for your comment. I think that is something that we have heard. The hospitals, one participant mentioned how, you know, they were told that the hospitals were supposed to have, you know, funding allocated to them to cover interpretation. But as this participant mentioned, you know, when they would call the hospital, they would say, oh, we can't provide that. That was in City of Toronto specifically. But, you know, again, just as you mentioned, that education piece and, you know, sharing that knowledge about, you know, that funding exists is really key.
Yeah.
Thank you for that.
Okay, I see we have a question from another Fatima actually about telehealth. Fatima, could you expand a little bit on what you'd like to know? Is that in terms of interpretation? I'll just unmute you here as well. Please go ahead. Is it Fatima Ekbal? Are you there? No? Okay, sorry. She sent in a clarification in the chat box. Just a moment.
Okay.
Sorry, I'm still not quite clear on the question in relation. Oh, if when you call telehealth, can you call and ask for an Arabic-speaking provider? Do you happen to know the answer to that?
I don't currently know the answer to that, but that's an interesting question. I'm just writing that down. So can you call for an Arabic-speaking support person at telehealth?
That's right. Yeah. Would there be a nurse who speaks Arabic available, I guess, is the question.
I don't know, but I think that's something that I would be interested in looking into.
Sure. Thank you.
No problem.
Okay. Are there any other questions?
Yeah, there's a hand up by Deborah. Deborah, you're unmuted. You can ask your question. Deborah, I'm not sure if you have a mic. We can't hear you, but you had your hand raised. Okay, it's unraised now, so I guess you didn't have a question. If you did have a question and we just can't hear you, feel free to type it. Okay.
Okay, I see another question coming in. I'm just going to read through it. It says you spoke about some recommendations and practices to better our collaborative response to refugees, but I'm curious, what is being done today to assist with the fairness and equity problem that we had in the past? How are agencies and sponsors dealing with that to provide equal services and tools to our refugees? When you talk about collaboration, can different agencies, can we help to provide resources so that we ensure all refugees can get help with the same needs?
That's a good question. I think raising the awareness of the fact that this is an issue, specifically, is our first step, at least from our end. And I know that from the participants that, you know, raised this issue, it's something that they're trying to address. So, for example, within these, you know, working groups that were created ad hoc as a result of the response, some participants, and even from my experience going to some of these working groups, they're trying to continue the effort to make sure that the resources that were mobilized for these collaborations are actually extended. So, for example, in the region of Peel, there was a working group that was developed by, you know, housed and chaired by the region itself, the regional municipality. And so, you know, in those discussions, it was a one-year working group. but now trying to continue that on is what they're doing within these, within the last month and the next couple of months, to make sure that this actual working group continues on and addresses all resettlement, trends and needs, not only specifically for the Syrian refugee population, but also for other refugees as well. And so, that is one thing that is off the top of my head, that's something that's focused on. And again, with the resources, especially when it comes to the differential treatment, trying to share this with policymakers is something that we really want to focus on, because the differential distribution of resources, the fact that people are saying, it's a large volume within a short time is of course that's relevant, but we also want to make sure that it's fair to everyone. And so I know at Access Alliance, our board of directors was involved in, writing a position letter to the federal government and the Minister of Immigration and Refugee and Citizenship to, talk about the transportation loan. So that's one example where there was inconsistency even among the Syrian refugee cohort that arrived from 2015 to 2016. So that advocacy piece is also another way to ensure that there is fairness and equity across the board. So I would suggest, looking into your own agency and talking to the management and leadership about what you can do as an agency to make sure that things like differential distribution of resources or differential treatment, for example, the transportation loan, how can you advocate to ensure that that is addressed? Because at the management level and the board of directors as well, they have that that position also comes with power. So trying to leverage that to advocate for more fairness and equity for all refugees and more broadly.
Thank you, Fatima, for highlighting the advocacy piece.
Mm-hmm. You're welcome.
So a couple more comments have come in back to the interpretation question. So a couple people have confirmed that yes, through telehealth you can access service in Arabic. And also someone highlighted what's called the Live Line service, which is available at all hospitals to provide interpretation, which could be relevant in these cases. Are there any other questions? Going once, going twice. Oh, okay. Okay, so this is interesting. This is this says they conducted a similar environmental scan in Hamilton, Ontario, regarding navigating the healthcare system, and their findings were similar. They also recommend that culturally competent care be supported organizationally as well as at the individual level. Did you learn anything about this in your study?
In terms of culturally appropriate care?
Yes, that it be supported organizationally as well as at the individual level.
I think that's something that definitely was mentioned when it came to the initial planning process, and throughout the planning process, having that presence of the existing community was something that some participants mentioned that wasn't there initially, and an ongoing understanding of how to make sure that systematically that previous newcomers or the community that exists is already involved in that planning. And I think that that's something that was also mentioned when it comes to navigating the healthcare system. And it's interesting because I remember a couple of weeks ago, someone asked about interpretation and trying to make sure that that is accessible for newcomers in their language, but the lack of interpretations, like staff and also funding. One participant talked about how is it possible to engage medically trained people who are medically trained that are from Syrian background that are not necessarily trained in interpretation. And that's something that was interesting for me because, I reflected on that as well. And that's a way to engage, especially at such a high stress time. Because of course there are processes to go through interpretation, but ensuring that planning ahead of time is important. And also organizationally, having that understanding is key. So I think that we have documented that, but that's definitely something that we intend to, parse out in more detail in our final report. But thank you for that question.
Okay, great. Thank you, Fatima. Another question is, do you have any data on the issues faced by refugees? Was that part of your study?
The data faced by refugees. Oh, okay. So our focus was primarily on, documenting the experience of service providers. So we haven't done any, interviews or anything, like surveys or anything like that with refugees in particular. So that is something that, I think there's research that's being done by my colleagues here at Access Alliance that is focused more on refugees, and that is a longitudinal study. So I know that there is a one study that is a CIHR funded study by one of my colleagues, Dr. Yogendra Shakya, and with other partners. And that is focused on the differential pathways and integration among Syrian refugees that are arriving as privately sponsored refugees versus as government-assisted refugees, and is looking at that integration experience over time. But for this particular study, we did not consult or interview refugees specifically.
Okay, thank you.
Welcome.
And going back just to the case of Hamilton, this person is sharing that they did meet with Syrian refugees there, and that their main concerns were centered around culture shock in the healthcare system in Canada. A long wait for service. Yeah,
I think we did hear from service providers as well that trying to support that care and trying to support that care upon arrival was a challenge. And even when it came to voicing the concerns at the temporary accommodation sites, the whole idea of having that on-site care came from the experience of newcomers at the hotels having those immediate resettlement needs and not knowing how they could be addressed. And volunteer organizations and volunteer groups also sharing that voice in the beginning and saying we need to have clinics on site because the transfer of care to even transporting people out of the accommodation sites to different appointments was difficult. So having that on-site clinic was key during that initial arrival response.
Okay, that's great. Thank you, Fatima. I think that's, if there are no final questions, I think that's pretty much all the time we have for today. I'll pass it back over to Sarah.
Thank you, Lorraine. Thank you so much, Fatima. This is really interesting and lots of information. Thank you for sharing your contact information. If anyone has more questions, you can get in touch with Fatima about the presentation that she did and about the study they did at Access Alliance. If you have any other questions for us as an attendee, please, you can contact Lorraine or I at refugeesettlement@ocasi.org. That's refugee settlement is one word, at ocasi.org. You'll receive a follow-up email in about 2 days with a link to today's recording as well as a copy of Fatima's slides. And there will also, on the same page, there's a list of the upcoming webinars. And at the bottom of the follow-up email is a link to an evaluation survey. We would really appreciate it if you could take about 2 minutes to complete that survey and provide your feedback, which is really important to us. So our next webinar is actually not until July 27th. It's more of, rather than a best practice, it's more of a resource sharing with frontline workers. We have Kelsey Lange from the Refugee Sponsorship Support Program joining us to tell you more about what they do in that program, which is basically an assistance to sponsors, to refugee sponsors on around completing applications for refugee sponsorship. And so if you have clients who are newcomers and are now interested in sponsoring their relatives who may be refugees somewhere, this could be a really good resource. It's free. They're all pro bono lawyers. So she'll tell us a little bit more about that process and what they require and who's eligible and so on. So that's on July 27th. Again, that link will be, and more information about that will be in our follow-up email. Again, you can call us, reach us at refugeesettlement.org if you can find a follow-up email or you have any other questions. So on behalf of Okasi and Fatima and Lorena and myself, thank you so much for joining us today, and have a great rest of your day. Thank you, and a great long weekend as well. Thank you. Bye.